When you hear the words ambulance chasing, you might think of lawyers, but the I-Team is about to show you a whole new kind of ambulance chasing. In this case, it's the ambulances that chase patients and their health care dollars. Here's Stuart Watson.
This is the tale of two ambulance companies, one town, and the fight for health care dollars. The town, Fort Mill, South Carolina. The companies, Piedmont EMS, run by the for-profit Piedmont Medical Center, and the nonprofit Fort Mill Rescue Squad. The chase starts here.
911, police, fire, medical.
In Fort Mill and some other parts of York County, dispatchers send not one, but two ambulances to every call. One Piedmont EMS, one Fort Mill Rescue. Listen.
EMS 4, Fort Mill Rescue Squad, priority 1.
And they're off. The first ambulance to get to the patient gets the patient, and the ambulance that gets the patient gets paid.
It is the transport that generates the bill.
Piedmont Medical CEO Charlie Miller.
Is it a race to the scene?
Some view it as that.
Are you racing?
No.
Is there a race to the scene?
I'd like to think that there's not.
Fort Mill Assistant Director Tim McMichael.
Occasionally there might be a little bit of drafting going on as two units follow each other, but we're definitely not out there swapping paint.
There is another downside to competing ambulances, patient choice. In this case, whether you as patient get to choose your emergency room. At Fort Mill Rescue,
What do you say to that patient?
Which hospital would you like to go to?
Open-ended.
Open-ended.
but in a Piedmont ambulance,
They're told that we're going to take you to Piedmont.
it's a statement, not a question. Piedmont's EMS director sent out this memo in February saying competition in healthcare can threaten the livelihood of each and every one of us. Once a decision is made for transport to the emergency room, your response should always include, I will be taking you to Piedmont Medical Center. Piedmont's CEO says patients know they can tell the driver to take them elsewhere.
All you've got to say is, I'd rather go to Pineville. If it takes more than 15 seconds, I'd be stunned.
The I-Team checked the numbers. In the last year, Piedmont EMS took 68% of their Fort Mill area patients to Piedmont Hospital. Fort Mill Rescue Squad took only 42% of patients to Piedmont.
We have reason to believe that the staff at Fort Mill Rescue work hard at making sure the patient goes somewhere over here.
And why?
They view us as adversaries.
I'd like to say that that perception is not accurate, but I do think that the enhanced competition that this area experiences may cause some animosity.
If there is animosity, it's because in the last 2 years, Piedmont has doubled its Fort Mill ambulances from 2 to 4, in effect double teaming Fort Mill Rescue Squad and threatening their business.
That's not the reason we've done that.
Miller says Fort Mill has boomed and Piedmont is simply keeping up with the calls.
We're a business too, and yes, it is about market share, but also it's a need. We look at response times.
The market share is not just for ambulance calls. If Piedmont Hospital treats the patient, they get more money. And at Fort Mill Rescue Squad,
We have no vested interest in transporting patients to a particular facility.
Piedmont is also hoping to raise its visibility while it competes for the rights to build its own hospital in Fort Mill.
I think there is some marketing going on.
Cotton Howell at York County's Emergency Management oversees the county's ambulance contract with Piedmont.
We hear the comments occasionally that the ambulances are trying to beat each other there. I can't document that.
So while Piedmont fights for a new hospital, and Fort Mill Rescue fights for patients to support the squad, the chase is on. Stuart Watson, News Channel 36.
Now, the political body that would have to pick between Piedmont and Fort Mill Rescue is the York County Council. Cotton Howell says council has so far sidestepped the question. 5 of the 7 county council members have been ousted in this past election, so the new council will inherit the question.